The biggest concern is, of course, twofold. One is how are we going to get through this? The severity is of such a magnitude, It's not just in Singapore, it's globally. We had experienced SARS, but SARS was nothing like COVID-19. And as it unfolds, as the situation unfolds on a daily basis in the initial stages, it looks like it is graver and graver, So the question is whether our health facilities, our economy, our people are able to go through such a severe disruption, and we're able to come out intact. Then the second issue is, of course, the question of how much past reserves we need to use to address that situation. With regards to the past reserves, I'm very clear in my mind. I'm only authorized to release past reserves for exceptional, very exceptional circumstances. So both the CPA and myself, we have to, when the Minister for Finance comes to us, when the government comes to us more specifically, to say that we need these reserves to do these programs, then first we have to ascertain whether this comes within the confines of my powers. That is, this is very exceptional circumstances. And of course, as I have described, this is a double whammy, both a health and an economic crisis, and clearly established that there is a need for us to pull down from the past reserves because the government's current reserves is not sufficient to run the programs, build the facilities, buy the ERT kits, support the vaccine program, and so on. So we established the reason that is it truly exceptional? If the answer is yes, then we go to the next question, and that is how much of the past reserves should we allow the government to draw down? Now that is a very intense process. The first part is really intense because we have the government, Minister for Finance, Minister for MTI, Minister for Health, and all their officers coming to brief us, for us then to ask the questions, the relevant questions, If you say the health situation is critical, what do you mean by that? Hospitals, if you say it's going to be overwhelmed if you don't have additional facilities, what do you mean by that? So once we've established that, then we go to the second part, and that is the question of how much to draw down. That is for the government then to justify, to say we need this amount, these billions of dollars for these purposes and these programs. And the programs are then all itemized. We need this for vaccine, we need this for building additional facilities, for ensuring that the front line, especially the healthcare workers, are protected, protective gears and so on. So I think once they provide that, then we understand better the situation, then we can talk about whether we want to support the government's request to draw down the past reserves.
So in other words, there were robust discussions between yourself and the...
I must say the discussions are so robust. So many meetings. You remember there were 5 drawdowns from the past reserves. There were 11 budgets throughout my whole, 6 years of service. So you can imagine there's only 6 years, right? But there'll be 11 budgets. I mean, there were a few budgets during the COVID period, when it traversed the COVID period. And, and we had many, many meetings. And those meetings actually don't last just half an hour. They lasted a few hours because we need to ask questions, we need to be satisfied. We wanted more information, we get those information. And even during COVID, you have to bear in mind that these were all done during the COVID period. We had to also take into account the social distancing measures. Half of the CPA and the ministry's officials had to be separated, put in a separate room because we can't be all together. And then we do via Zoom, so that everyone is still on the same page, but, whilst observing the social distancing measures. It was very thorough, but it was done in an atmosphere where we respect each other's roles. We understand what we have to do. The government has its role, to make sure it provides for the people during such a critical crisis. We have our role to protect the reserves and to make sure that the government's request is reasonable.